For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hi, good morning. My name is Indira Fonseca, Public Information Officer here in Santa Clara County. Please note that we will be removing our face coverings to help others understand us better. Today we will be discussing gatherings, given that upcoming holiday seasons will be happening soon and we're in a post-election period. Please note that we want our community to practice safely when gathering with others, and we want to provide all the tools necessary in order to do so and prevent any COVID-19 transmission, and also provide and help us move forward to the next tier here in Santa Clara County. This morning, we want to spend some time discussing keeping our community safe with small and large gatherings, and also share additional information with our gatherings directive. Also, please note that this information will be available on our website, Santa Clara County COVID-19 website. We know that there are some questions when it comes to risk associated with face coverings. We have an expert with us, Dr. George Hahn, our Deputy Health Officer for Santa Clara County Public Health Department. Thank you, Dr. Hahn, for joining us.
My pleasure.
Do you mind sharing a little bit about how you support here in Santa Clara County and how you're supporting us now with our COVID-19 pandemic?
Well, I'm the Deputy Health Officer for the Santa Clara County Public Health Department. And what that means is I've been working on the COVID-19 pandemic response since January. And currently, I am the Operations Chief for the Department Operations Center, which is the main unit in our county that is responding to the pandemic from a public health perspective.
Thank you so much, and we really appreciate everything that you do here in Santa Clara County and helping us move on to the next year and also prevent any cases from happening. So thank you. Just a question: what do you plan on doing differently this holiday season?
Yeah, I was thinking about that recently, as I know many folks are. What are we going to do? And I think what we'll be doing is a lot of phone calls and sort of video chats with relatives from around the country, really. And we'll be doing that for the holidays. You know, it does. I know a lot of people are thinking about should they gather and should they travel, and the thing with gathering and traveling is they do have some risk because we know that COVID-19 is on the upswing in many parts of the country. And even here in Santa Clara County in the Bay Area, it might be trending up a little bit at this point. And what we're trying to do is do our best to keep it as low as possible. But we know that we're not an island. We know that we're connected to the rest of the state and the rest of the country, and they're experiencing large outbreaks. And so we need to be thoughtful, I think, about the risks that we take, and like what can we do really to minimize the risk as much as possible. I'm thinking, for example, if traditionally the week around Thanksgiving is a really heavy flying week, lots of people flying everywhere. And so if you imagine a lot of people going to the airport, sitting in the terminals, being on the planes, it may not be the safest thing to do. So the way to reduce the risk might be this year to travel by private car, or like what I'm doing is to not travel at all and just have sort of virtual gatherings, with the understanding that the reason we're doing this is to protect each other.
That's right.
I care about my family and friends' health, and they care about my health, and so the best thing to do is to, stay distant and connect virtually if possible. But yeah, that's my plan.
Thank you. No, wonderful, and I plan to do the same. Definitely staying home, making cookies, with my sons, and just, having pajama parties within our home. So it'll be a party of 4 in our household, but definitely like trying to maximize family time, whether it's virtually or just with the individuals in your household. I think that's what's safest, right? And hopefully, this time next year we'll be able to hug our loved ones.
Absolutely.
With that being said, we also do want to remind our community that gatherings at this time are allowed for the purposes of cultural political or religious events such as weddings and funerals. In addition, as of October 9th, the state has guidelines for private outdoor gatherings of up to 3 separate households. Of course, these gatherings must comply with our gatherings directive here in Santa Clara County, as well as our submit a social distancing protocol and the guidelines. With that being said, Dr. Hahn, do you mind sharing about the risk of attending a gathering?
Definitely. So, there are the gatherings that are sort of more formal, right? Like as was mentioned, weddings and funerals and that kind of thing. And when that kind of gathering happens, definitely there needs to be the host needs to set out expectations in advance so that people know that they'll be wearing masks the whole time, that they'll be distanced the whole time, that they're going to keep it short because the shorter the event, the better, the safer. And then limit the number of people, because the fewer the number of people, again, the safer. And so I know that folks have been creative about coming up with other solutions, like maybe having a small group at the actual venue, but then like stream it live for other folks to view at home. So there's those kind of gatherings, and then there are the more informal gatherings, dinner parties or backyard barbecues, and anytime you have a gathering with someone from outside of your household, there is some risk of COVID. And the reason for that is because COVID is widespread throughout our country and including in the Bay Area. And so because of that, we need to be thoughtful about what kind of measures we take to reduce our risk. And I think the important thing to understand about these safety measures is that no single one of them works 100%, but when you put them in combination and you layer them on top of each other, that becomes more and more safe. And so what I try to tell everyone is do as many of these safety precautions as you can, because the more you do, the safer you're going to be.
That's right. And some of the precautions that we were talking about earlier is wearing your face coverings. And just as a brief reminder, we do have updated guidance. It must be a minimum of 2 layers. Material fits snugly around the nose, mouth, and chin area, and hooking around the ears and or behind the head. And do not wear face coverings below your nose or under your chin. Also, please note that there are some face coverings that are not recommended, and those would be the neck gaiters, as we spoke about earlier, the ones that go up to the neck, as well as the face coverings with a valve. Those are not recommended at the moment. With that being said, Dr. Hahn, is someone that attends a gathering with so we talked about that a little bit. So say you wear a face covering, you're going to go to a gathering. Mm-hmm. How much protection does that offer you?
So if the face covering offers some protection, it's not 100%, as I mentioned. So it helps protect you from breathing any virus out and spreading it to others. And it also helps to a certain extent if there's virus in the air from others, from you getting as big of a dose of virus. And so that's very helpful, because the more virus that you can block from your body, from entering your body, the better, because your body has a better chance of fighting it off, and you might not get as sick if you're wearing a mask and exposed than if you never wore a facial covering. So definitely keep a face covering on at all times as much as possible. Obviously when you're eating or drinking, you have to take it off. Right. But then, as soon as you're done, put it back on. And I think it's really important to remember that you should still keep as distant as possible. 6 feet is the number that we give, but really, as much as you can, even more than 6 feet is even better. And the reason for that is because when you're for example, let's say you're indoors, which is a risky place to be. If there's no ventilation, then what happens is the virus just keeps building up inside in the indoor air, and then the next person in the room, even if they're more than 6 feet away, can breathe it in. And so that's why we always say outdoors is safer than indoors. But if you are indoors, open all the windows, open the doors, get some ventilation in there.
Shortening the time that you're
Yes,
indoors.
shorten the time that you're indoors. And so, have your event outside, but, even if you're outside, wear your mask, keep distant. And
Practice good hygiene.
one of the things that people do when they gather is they'll gather in the kitchen. Even if the event is outside, they'll come back into the kitchen to prepare food or things, and that's where we want to avoid that as well, if you can.
Common areas, that's right.
Maybe only the host is in the kitchen and then brings out the food or brings out the drinks, and limit the people who are coming in to use the restroom, let's say.
Right, and how you mentioned earlier, just protecting our loved ones, protecting ourselves. We have tools in place that we can utilize, when attending these gatherings, but also keeping in mind that, there are other options. We can, instead of having gatherings, having, like you said, a virtual event, which is, now technology it's better, so we can have different backgrounds. You can, FaceTime your family or Zoom your family while in Paris, with a little backdrop. So people have been getting very creative. So we definitely want to encourage that. But yes, definitely if you are attending a face covering, Dr. Hunt provided excellent guidance. In addition to that, under the current order, the county allows up to 200 individuals at an outdoor gathering. But just because it's allowed, is it safe?
Yeah, I think that those are really specific kind of guidelines that are kind of modeled over the state after the states, what the state is doing.
The tier system, yes.
I think that the more that you can avoid large gatherings, the better, and that you kind of have to make your own decision. And I think it's very true what our health officer, Dr. Cody, has said many times, which is just because it's allowed doesn't mean it's safe.
Or recommended.
Or recommended, absolutely. And so you got to think about, is there enough distance between everyone? Is everyone going to be wearing a mask? Is it going to be outside? So all those things are things that you have to keep in mind when you make those kinds of decisions.
Great, thank you. And also let's talk about a little bit about testing. So when requesting, when should people get tested? Before attending a gathering, after attending a gathering?
Yeah, well, in general, if you're kind of not staying at home, it's good to get tested regularly. For example, at least once a month if you're an essential worker, let's say. And perhaps up to once every couple of weeks, depending on the nature of your job and the interactions that you're having. If you do attend a gathering and you're concerned that you may have been exposed or that that distancing wasn't practiced or face coverings weren't used, you may want to get tested after attending the gathering, maybe a few days or up to 5 days, 6 days after the gathering. But you do want to watch yourself for symptoms for the whole 14 days after the gathering, because you could develop COVID at any time within the 14 days after being exposed. One of the things that I can't emphasize enough is that because there's COVID everywhere in our community, any one of us could have it at any time and not know it yet, right? And the reason for that is some people get infected and never get symptoms, but they can still spread it to other people. Other people do get symptoms, but they were actually contagious in the 2 days before their symptoms started. And so, that's why it's safer, even though you might be feeling fine, but you could be carrying the virus, you don't know. And that's why it's safest to sort of practice all the measures that we've been talking about, which include the face coverings and the distancing and being outside as much as possible.
Wonderful. We also talked a little bit about the long-term effects. There's some things that we know COVID is fairly new, and there's a lot of things that we're learning.
Yeah.
So do you mind sharing a little bit about the long-term effects of things that may possibly happen?
I think it's important for people to know that COVID is not just a virus that you get and then get over. For some people, it looks like they get COVID and then never recover back to their normal healthy self that they were before they got COVID. And so, unfortunately, some people actually die from COVID, and we definitely are doing our best to avoid that. But then even the people who survive, some of them actually have longer courses of illness. And what's concerning to us is that because this is a totally new virus, we are not yet sure we don't yet know what the long-term health effects of having the infection might be. You might have gotten sick for a week and then, seem to have recovered, but who knows what kind of long-term health effects might be left behind because the virus has only been around for a year, less than a year. And so it takes time for us to find out what kind of effects might occur later. So better to be safe than sorry. You know, we want to do our best to avoid getting the virus and avoid passing it on to our friends and loved ones and coworkers.
Thank you, Dr. Han. That's all very helpful information. Thank you for taking the time today, Dr. Han. We thank you here in Santa Clara County from our communities for everything that you've been doing. Also, just a brief reminder, we do have Facebook Live English and Spanish Wednesday and Friday, and also live in Vietnamese on Thursdays. So make sure to tune in. And also as a reminder, for our community here in Santa Clara County, if you're gathering outdoors, outdoors is safer than indoors. Wear a face covering, practice good hygiene, increase social distancing, and get tested at secfreetest.org. And on behalf of Santa Clara County, we want to thank you for your continued efforts in minimizing the spread of COVID-19.
And I'll just mention one last thing, which is, you know, we've been talking about a lot of these messages for some time, and it can get, you know, a lot of us are kind of tired of doing these things, and that's totally understandable. But it's important to know that the virus is still in our community, and so we can't let our guard down. One of the things that I've done is actually taken a look at some of our cases of COVID in our county. And I found out that, you know, the team found out that the reason a lot of folks get sick or got infected was because they let their guard down. You know, they were around friends or family, and then they didn't wear a mask. They went to a gathering. They didn't, you know, practice all the different things that we've been talking about to protect yourself. And so, you know, it's you know, you might get lucky once or twice, but like it's a little bit, you know, rather than depending on luck. It's better if you can, you know, try to, as much as possible, consistently practice the combination of as many of the different safety measures as you can.
That's right. Thank you so much, Dr. Han. Thank you for joining us. You heard it. This is what, you know, straight from our doctors here in Santa Clara County. These are the best guidelines. These are the tools that we're presenting to you to, again, keep yourself and your family members safe in your household and our community as a whole. Thank you.
Thanks.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.